so sutima tutina kakai kupuna kapan he English ni mon that many sakai sakura pun he yeah so mental health awareness tum topic hawa tilawam hawa na katay subject ko mental health to me it's a very common term ni ta me what na thai pam di na familiar sa me term di he ni increasingly soon ni wong hao he ki noi mi ni we are identifying more and more to what you call to care for our mental health yeah so ne kha bu mental health to me ni kha sin thai ma bang mai ni ni da na thai ma khau ba e ko ma chu wong khau ba e ani do own life ani ki nai mu ta ni thai experience na me go experience so pa ne ni ni at one point or the other ki tabi su tin so na ka khat ne te thia tabi su na mental health ra dawa ne kha ho ram ki mag na focus lau mga kung ano nga sin ani dong parents generation pang takong lunggay ni so ki ataw so na ho ki na kai ni ka thai ba mi tabi su tin so na khat ne te thia nang yu ni idea sang na kon de ni ni za ngai tabi jang ko mental health ka gi focus sa ka gi na rai bang so to me ta salam ni na ko ni any idea to be zankara why is there an increase in mental health concerns mental health issues nitong age ka nitong time generation ka
number one also use of devices extremely found like especially social media comparison like more now we are comparing with whoever is there in the world.
Yeah, exactly. So hari kita nekha ho ani the comparison ni tong parents generation ko ni tong palong na ko khut na ka ni tong affairs ni tong ton way to mi ta kha khan ni so ni tong point of reference to ni tong context thiam ina narrow so ina ta ho ani ko nga unlimited din na access ni device ko ina ya nang so mai ko ma comparison na kai he ni comparison for success to nani to do well in our areas lifestyle buni ni jao na fancy lifestyle can you compare so ilai hinani ni kai na khare mental health effects of that boy mo hoy ni other
overview the population town population only 25,000 na de no 30,000 say so suicide case every year kuma kamai hum patang hai mental health and mental sickness ma tum hai to hai ni part of a dino hai identify so hai kuma new resource person hai aram bahom de aram tum ara overview to solve la hai patam hai kulana suicide so mai tum ultimate hai tum tan khasam ni
kabang ko tui kon di hai ni ngai ni suicide rate ni increase about my mental distress experience about my psychiatric over across the world na bang tong hina kumara another factor bisut na mental health issues concerns increase about so the rakhani yani individual social media technology tung through kara what na connected to the so that it gives us the illusion that we're connected through social media, that we're staying in touch through device, but then slowly and gradually the media so it Western to influence guiding so media social media to nani device ka lifestyle exposure ta Western society individualistic simitong society mizang kara hetong values hetong influence na kai nani Western society individualistic sumikyo community based among my kanirana ta kanitong own secluded life, isolated life, and so so heta influence ni town we still have that collectivist mindset, which is very good. Church rini mabayin so home cultures in tribals nagas culture collectivist lean to now but I believe that slowly we're also moving towards the individualistic lifestyle ni experience of football meron na self-reliance may ni phone secluded so I think it's one of the reason, and individualistic lifestyle secluded to hair, isolate to hair to be loneliness is also one of the major things that the youths experience these days. People feeling lonely is like an epidemic right now. West kani slowly and all these things results to people feeling like there's no one to rely on, and it leads to say depression, anxiety, the common mental health disorders depression, anxiety, common mental health disorders to make so familiar depression, anxiety are common symptoms it's often compared to common cold physical health comparison so seasonally so anxiety, depression, common cold comparison with because at one point or the other we experience these symptoms. But if we talk about depression, depression disorder or anxiety disorder, much more severe, much more prolonged conditions. We may not meet that criteria. Experience mga na time to time ni. Mental health disorders, mental health disorders mental health practitioners rely my DSM ICD book relies where all the disorders are mentioned, criteria symptoms there are different types of mental disorders. Severe severe the psychosis severe mental disorders severe to it to tell where a person lose touch with reality. Normal functioning let's on going about our day, doing activities that sunga mang may na ni because psychosis ka so it hallucinations ko may ni hallucinations to me there are two types. One is visual hallucinations that how depending on the condition, depending on the individual color pangkani distorts to ni figures how to ni visual hallucinations to auditory hallucinations ni phone so ni man sai rin na chowa mai ko mai noise pang it could be bizarre things or animal phone so to ni ko ni ni sensations ni hallucinate mi dong sensory hallucinations mi dong kui gong da ba mi ko mai khat kazo ni ko mi hay psychosis na so the ko me hallucinations kan the he ko losing touch with reality, not being able to go about their day and function like a normal human being, kanitong day-to-day life that affects them psychosis to kuma examples on psychosis ka schizophrenia me chu khone ni ko me he delusional disorders pang nai adanim palagi sa anybody the time in anyone can think of any severe mental disorders bipolar bipolar tadina having highs and lows manic episode nai ni grandiosity of thoughts can you nai depression in that there are episodes of two poles apart many time in bunny
split personalities
personality disorders that are not neurosis there is there are so come to psychosis neurosis there are new normal individuals who are able to function to a certain level in our day-to-day life, going about our work or studies or doing the activities of our life. Normal functioning so it impairs the quality of their life. So there are personality disorders, split personality disorders, and personality disorders personality disorders but I'll just mention briefly overview I'm just setting the context of mental health conditions another is the ADHD I'm sure a lot of you have heard about it. It's on the rise. It's very common these days. Awareness ni nai, but at the same time again, exposure, lifestyle, ADHD features ko ini nakaibang tong nai attention span short sumay ko mai, focus sunga mang mai, concentration sunga mang mai the ADHD ni learning disabilities so reasoning power the students learn maths learning disabilities there were neurosis anxiety disorders neurosis because person with anxiety disorders, the severe level of anxiety condition, they're able to go about their day doing their things, but it impairs the quality of their life. Ni neurosis, depression, we all know, low moods, and not being hopeful of the future, having low self-esteem, substance abuse disorder, it's a mental health condition. Substance to me are different, any kinds of substance. It could be alcohol, could be drugs, it could be tobacco, even caffeine. Overview, if there's any particular thing that you want me to elaborate on, you're curious about, or you have any insights to share, please feel free to share.
Reasoning
dyslexia, the learning disability. Dyslexia, Rina, I think, I'm confused that I'm dyslexia, there's graphia, no, I don't need. Dyslexia, Rina, it's a neurological condition, it's a neurodevelopmental disorder. Brain wiring, the boy, allow for the signs has to be present from childhood to meet the criteria of dyslexia. Or registers some people, some individual with dyslexia, they say that the words move around and jumbles word sounds the difficulties So there were mental health disorders, severe neurotic mental health so it's not just those disorders, the severe conditions that mental health is not only about illness. You and I, we may not meet the criteria. We may or may not have these conditions that fulfill this criteria. But mental health to me, it affects how we think, how we feel, our behavior. It affects our behavior also, and how we handle stress, how we relate to people, the quality of our life, the quality of our relationships with our friends, our family, people around us, impacts it on me. So it's important to be mindful of where we stand in terms of our mental health, what area needs focus on, and we can talk more about it one by one. Physical health, functioning, body functioning, mental health day-to-day life, day-to-day functioning. For example, two people may face the same challenge. For example, failing in exam, losing a job opportunity, or experiencing rejection. But how they respond to these situations may be different, influence how they respond and recover.
Miss, can you suggest one possible way to strengthen my mental health? One possible way.
We'll talk about that also, but
I guess there will be a question hour.
Question hour ni not happening there, but anything specific
Okay, afterwards let's go.
Sorry?
Let us discuss afterwards, after completing your lecture.
So mental health is not simply about avoiding depression or anxiety or low mood, but it's about understanding ourselves, managing our life's challenges, building meaningful relationships, and becoming the healthiest version of ourselves. By definition, mental health, it refers to a person's emotional, psychological, and social well-being. It has to be holistic. Emotional state, emotional state hai, psychological state hai, social well-being. All these things has an influence, impacts our mental health. So mental health bangko or we topic saya rok me war penjon na khat na regan na bina bas so hagin nani ki I've decided on two things which I think may be important. I feel it's important for all of us to know, every individual to know, and that is the importance of self-awareness and emotion regulation. Hay nai lang khao thok nga oi kha salam ni kelo. Self-awareness to my quite self-explanatory. Mirona mita time like self-awareness and identity. Identity. In order, so the mental health important to it's important to focus on our mental health. So the first step I believe is to be aware of our emotional state, our psychological state, our thoughts, our well-being altogether. So self-awareness to my it's the understanding of our thoughts, emotions, triggers, strengths, and vulnerabilities, and knowing who we are as a person. What do we like? What do we not like? What are our values? What are our beliefs? We can be more discerning in taking action, deciding how to react to a certain situation. So yeah, khatsalada ni merna anidong thoughts, thoughts, feelings, and behavior are connected to hamina. Psychology, therapy, there are different types of therapy, and then there are different approaches to therapy also. And there's one particular therapy that called CBT, cognitive behavioral therapy. This is their premise of it, the foundation of. They believe that this approach believes that thoughts influence feelings, and both thoughts and feelings together influence our behavior. So in examples on there were, for example, nagari thawom hinani gari thaw na sang tabong ka say around ka kanyo around kani relevance pong the ending ki say highway dot na ka tabong ka nagari thawom migan ka mai kharina overtake so hinang ka put migan ka ta what is your instant thought, immediate thought ni? And you don't thoughts it keeps tell up the kretana zima me pow thoughts get underlining so and your own internal thoughts when thoughts based upon triggered by our environment, stimulates it in any environment. Thoughts nagaina. Thoughts keeps it happens so fast, so quick that we fail to notice these thoughts, and we tend to feel certain things because of these thoughts, and these two thoughts and feelings together influence our behavior. So the example to Sodre Nagari Thawa Migandata. What would be your immediate thought? If anyone would like to share. My karena Thawa Miganda overtakes it now my karena.
I could have met an accident, but by God's grace, I'm safe.
Okay.
Saying in the signal dinner, any one of the dinner, take over the fun like turning good man. Mitani risk the Tipala, Kamani risk, no, approaching legal from the other blind corner, giving risk the Parama, lukewarm that.
And nang lubok may tanang swadik na, you're talking about your feelings there. But what exactly is the thought that will pop up in your head?
About here needed.
That's the.
But take over the night, Carol to me, and
Come on.
to me, want to hear to me. The road rage to a like that.
So you felt angry, and because of that anger, you feel like overtaking, revenge meaning. But there must be a thought before you felt a certain thing. Something like sit bahagida, or like how dare that person or something like that. Extreme thinking had so the whatever thoughts we have will influence how we feel and how we and then it will affect our behavior also. But for example, if you another example, Sadhana, same situation scenario khata kum overtakes it na. If you are able to recognize your thoughts and then pause for a bit and try to see every perspective, more rational thing. Or he must be in a hurry. So personally, you will feel much more calm and collected, feelings, and then behaviorally will be grounded, will be. So importance of self-awareness, it's so important to recognize our thoughts. What thoughts happen so fast, so quickly that we only experience the result of it, the feelings and the behavior of it. But if we take a moment, if we have the habit of questioning our thoughts and asking ourselves, is this the most rational thoughts? Is this the most balanced thought that I can think of? Am I taking every perspective into consideration? You will, you'll be able to notice it more. You'll be able to take control of yourself much more. Thoughts it's so important to notice our thoughts, and with practice it will come. Pause and rather reflect more. And the way to recognize our thoughts is to write journal or like take some time out and questioning ourselves, how am I feeling these days? What's going on in my head right now? Suppose when you're stressed, when you are going through some things, like could be relationship, could be work related, could be study. One of the most common thinking error is assumptions. Assumptions like say take any situation, any scenario. Say you your friend you called your friend ni call some pick up some and pick up some that's the situation and what is if you think that he must be busy or I think he'll call me back, you know. I mean that's a positive sighting. So okay, but if your thought is like your immediate thought is like us again sit pick up some avoid assumptions. So that's not a fact. It's possible. There's a possibility that your assumptions may be true, but there's also a possibility that it could your friend might have completely different reason for it. So assume sumai kamai na ata kuma ning la dike hai la choba mi ho ata kuma ning tin he tin zo ta ni kum zo ta ni trin na facts we na ni assumptions he kuma another is jumping to conclusion. Slightly similar to assumptions, more like predicting the future. Or example situation based on our past experience with a certain thing or maybe a certain individual, thinking that the same will repeat again or pretending as if we know what the future is, you know. Fixed mindset we tend to do that. And the other is all or nothing. All or nothing thinking, sorry. Again, extreme thinking. For example, extreme example lona. Or example 100 marks I'm a failure. There's no room, having no room for gray areas or having no grace. These are some of the thinking errors. When we notice our thoughts and we have the habit of writing it down, maybe, or reflecting, asking ourselves, we may find these things patterned in any. So if we catch ourselves doing this, we should ask ourselves whether this is healthy for us or not. I mean, thinking bias like again, we're not perfect. As humans, we're not perfect, but we can ask ourselves if these thoughts are affecting us. You know, say for example, assumptions assumptions it's impacting their life, their quality of life, their relationship, their day-to-day functioning. That becomes, there's a need to ask ourselves if this is healthy, if it's helping us or not. If it's not helping us, if it's causing us a lot of distress, a lot of stress, then there's a need to change these thoughts. I don't know if this is becoming too technical and too question I think it handle.
Yeah, but it's sometimes you can't find asking for a friend. Help to have any suggest
rakat ini ni identify sini to ni assumption setan he nang kum kan to he
conversation ke tu point lah. Nak ambil scenario ini lah, tuan tak nak pun soal nak. Nak pun tu kita pun siapa ni nak.
Kama
Help kan dia help so
gently nobody likes to be corrected in a very stern manner nang takumam ta but gently hai tani kum kan to he tani kum maybe you have this habit of making a lot of assumptions, you know, gently nudge you, gently remind you, I think that will help. Yeah, I don't know. There was interconnectedness of thoughts, feelings, and behavior. So, thoughts, the reason why we need to ask ourselves these is because it affects how we feel. And feeling just goes according to what our thought patterns are, most often. Sometimes, because we feel a certain things, we're in a certain mood, it can influence our thoughts also. Most often, it's always the thoughts influencing our feelings. When we think about good thoughts, good memories, we feel happy, we feel light. But when we think about our problems, when we think about our problems, it affects how we feel. And these two will affect the behavior, what we do. Example, say a person is receiving a criticism at work, and supervisor says, your report needs more detail. Person with low self-awareness, their reaction might be, they take it personally, they feel attacked, they become defensive. And when they react like that, their response is maybe, they will think like, nothing I do is ever good. A person with low self-awareness will think like this, but a person with high self-awareness, they may feel like the same situation they may think or feel, I'm feeling defensive because I want to do well. They know why it's making them feel bad about it. The criticism is about my work, not my worth. It doesn't speak about who I am as a person, but it's about my work. And so this person with high self-awareness may likely ask for examples, learn from feedback, and they'll grow and improve. Another example has other in career anxiety. A young person sees their peers, their colleagues getting promoted. So in this example, a person with low self-awareness may think like, I'm a failure, I never succeed. And their behavior, behaviorally they might panic, they may make impulsive decisions. But someone with high self-awareness, their reaction might be the same situation, their colleagues getting promoted. They might feel like I'm anxious because I compare myself to others. And what I actually want is more direction and progress. And behaviorally, this person may create a plan, stick to mentorship, focus on personal growth. So it's so important to ask ourselves to be aware of our thoughts, our emotional state, why we're thinking a certain way, why we're feeling a certain way, in order to have a better response to situations in our life. So, yeah.
ขาดแต่ประกายกันที่ตรงเราแต่นี่กันใช้เพราะกันนี้เรากันนี้ผมทอดสรีระที่เราในสูงน้ำไม่น้อยนั่นเอง
react
กันนี้ผมทอด feeling กับกันนี้เรานั่งว่าโพสเราหน้ากันทำได้ไหมกับกันนี้ห้องน้ำกันใช้ห้องน้ำไม่น้อยนี่กันใช้เรื่องนั้น immediate reaction นี่น้อยให้กันในนั้นก็ตัดกันไม่ป่วยนะครับเพราะแต่นั่นตรง positive นั่งเชื่อละกันแต่นี่ positive point ก็ตัดไม่ป่วยต้อง reaction มากๆว่าไม่ต้องเรื่องของเรานะไม่ต้องฟังอะไรไม่ยิ่งก็ใช้มานี่แต่นั่งเลชั่นอันนี้ของจำน้องไม่คนละถอยให้ก็ไม่ถึงถอยให้ทีตอนปันนี้ไม่จับอันนี้ดูครับกันใช้ต้องฟังอะไรไม่ฟังคนนี้วิธีสวยจะได้เนี่ยตอนปันนี้อันนี้ก็รักแต่ว่ากรีดเขาปันไม่เขาแต่ไม่ใช่เงินลูกของเรากันไม่ตรงนี้ลูกก็ไม่ได้ท่าเนี่ยผมก็ขัดขายได้เลยที่โกงตรงนี้นี่มันเป็นแค่เรื่องแบบ
yeah sure very important แต่ว่ามาถอยแล้วไม่ถอยแล้วแบบเป็นแต่ตอนพอหังกุ้งอย่างนี้ just like any other thing takes practice just like learning a skill guitar bunyi driving bunyi learning to sing or anything studies ka bunyi practice suga ilaw it becomes more automatic in our response so initial stage it might be quite frustrating to notice our thoughts, to our feelings, and pause in my reaction, the pause in my happening ki so katub go ngai to thia soy mga rakar kung improvement na ko ni de this is basically what we do in therapy. Therapists in our client helping them identify their thoughts, feelings, and kung kanto ke discuss na past experience the example lo na ni kung ikan ta kung kanto ke kung teo kung bitia kau kada no bo automatic ni ta ra bitia homework na kan ni ti ra be just a sheet kani worksheet ka thoughts, feelings, behavior ta so fill suna just like ni la re hi tha mi ya hi thoi mi ya abc ro ka so a b na ko me hi ta da ni so hai ta kuma basic sunani scenario law, example law, own journaling company, the worksheets company, therapy company, it deals to train ourselves to recognize our thoughts and feelings and our behavioral patterns. It comes with practice. Mindful, the more we are mindful of our internal thoughts and feelings, the more you get better at it.
Identity lang po ay coordinated for first session, second session, plurality to me ay self-awareness yun yung influence na kaya social media tapos Western culture na society, community society. Kung tawag ko lang na ito na lang, Christian identity na. Kung may lungkawa, ito self-awareness yun yung do we stay in touch with every one of them? Or should we choose one? Kung may tayo, kung hindi ko experience ka, kung identity ha, mayroon ko self-awareness na influences kayo lang po. Ito yung number one kanang na emotion regulation ba? In your experience, is it especially for the men? Is it good for men to be so in touch with their emotions and their feelings? We cannot deny biological differences between women and men also. Professional opinion.
Okay. I think you pointed out very rightly an important point, which is the self-awareness, identity. Now, secular perspective, so it's all about who you are, what you think, what you feel, what you feel most genuine. Focus on writing so, but Christian where we know where we stand. Identity to be zone Christian perspective katara. And I think the kuma new exposed to na learn to na ba make new camp company kuma church company adi to Christian beliefs ko and it's very very important in shaping and forming our identity. But if we expose ourselves to the world, if we listen to every perspective, it can get very confusing. And second point, emotions. I believe that's the idea is that woman feels more, men a little less. I think that's what you're trying
At
to
the same
indicate.
time, men are not robots to be more specific.
Exactly my point. That's what I was gonna say as well. It's just, I think the difference is how we express them, how we feel them. Although they may show less, they may learn to shut their emotions much more than women. Emotion humans they deal with their emotions differently, men and women deal with it differently. They like to share, talk about it, express it out, vent. They find it they find such comfort in that. Feeling heard, feeling understood is so important for them. But for men, and I think socialization influence it's not necessarily that men do not feel, but culture influence
We grew up in a society which encourages men to be tough and brave.
yes, to put up a brave mask. Come on. And Solfa because emotion strong and world leaders they there's a lot of impact in how they deal with their emotions. Negative impact not knowing how to express themselves in an appropriate manner, not having the vocabulary to express their feelings. I think we prioritize expressing, so we have much more vocabulary to express how we feel, our internal experiences. But men, I don't think men talk a lot about feelings, but more about facts and stories. But I think men do feel equally as women, but it's just how the intensity of it, the priority of it, how they express is what differs.
All or nothing they don't mindset to extremist
Extreme thinking.
see theภาพนี่บ่อยถวายพักถึงตรงสำหรับ all or nothing มันให้คนมาเนี่ยตรง mental health for the wheelchair or effects one more that we don't get in the counseling.
Yeah, all or nothing thinking is very common with people who experience anxiety. Extreme thinking situation for example, you're trying to rush to catch a bus or flight. Extreme thinking it's more of assumptions also here. Perfectionist thinking all or nothing thinking and people who have a controlling tendency, say taking an example of mothers who wants to control everything at home, everything has to be spick and span, perfectionism there gives a lot of anxiety for them and for others also. So am I answering to your question? The way you answer.
Okay, I know mindset
How it affects?
all nothing of that is also just seeภาพถวายพักในตรงที่เขาจะกระสุนเขาเอาทำไมวิศวกระสุนในแต่ละ 치료비는 또 하수 마음의 마음과
어.
마인드셋 mental health that is effect on
Oh, definitely.
how to be able to think
Oh. Yeah. So again, anxiety, even depression also, this type of thinking is very common. So first of all, again, awareness of our thoughts and how it's affecting our feelings. Once I believe that awareness is the first step. As soon as you are aware of these internal dialogues, internal experiences, we should pause and we should correct ourselves, correct our thoughts. Oh, this is too much. This is extreme thinking. I should be more lenient. I should be able to give importance to the gray areas in between black and white. So compromise this having a more forgiving spirit to ourselves and to others also. Balance is so the first step is to become aware of it. And once you're aware of it and you knowing how it impacts how you feel, you pause and you correct the thought patterns. And katina flexibility kung space team itani. So there in our self-awareness involves self-awareness improves the whole. It involves asking, what am I feeling right now? What did I feel in that situation? Or what am I thinking? What triggered this? Why am I thinking and feeling this way? What is the triggering point? And what do I need right now? Asking ourselves, and how do I want to respond? We have to have the habit of asking ourselves these questions. What do I need right now? Talking about needs, there are primal or fundamental needs, biological needs or survival needs such as food, water, sleep, physical safety, shelter. These are the biological survival needs. And emotional needs, need for connection, need for security, to feel safe, and competence, to feel competent in whatever we do, and need for recognition, respect, meaning, and purpose. And we may or may not be aware of these needs, but every human has these needs. And many emotional struggles arises when one or more of these needs are not met, are chronically not unmet. Again and again, repeatedly. Suppose you're constantly disrespected by people around, say your family members or your friends. One instance we can forget about it, two instances we can forget about it, but if you're in an environment where you're constantly being triggered, where you are disrespected, or your security, your recognition and confidence is being compromised, and we tend to grow resentful, and there's a lot of issues that arises inside of us. So we need to be aware also of our needs. What is our need? What is it that I need it, and it's not met in this situation? So if we know our needs and if we're able to identify these things, we can act appropriately to get our needs met, to go and get our needs met, right? So for example, examples on loneliness may signal an unmet need for connection. Time and again, if you experience loneliness, your need for connection, again, the basic emotional needs for connection, humans, we're social animals. We need to feel connected, we need to feel belonged, we need to share, and we need to love and be loved back also. So if we're not, if this need is not getting met, we may experience loneliness over time. And then anxiety may signal a threatened need for safety. And a sense of emptiness may signal a need for meaning or purpose. Feeling empty, boredom also signals that your need for meaning and purpose in life is missing. And frustration may signal blocked autonomy or competence. As a child, independence our needs may be quite basic, like the food, safety, security. But as we grow older, as we mature into adulthood, all of us have this need for autonomy, freedom, need to have to do things in our own terms, to feel competent, to feel like we're contributing to society, for example, or we are doing things that we are good in. If these are not met, you may grow frustrated also. So it's so important to be mindful of the needs, all these needs. Again, just to repeat, biological survival needs, emotional needs. I'll just repeat again. Need for emotional needs, need for connection, need for security, need for autonomy, need for competence, need for recognition, need for respect, and meaning and purpose. So in this sense, our emotions function like an internal guidance system, drawing attention to needs that may require care or attention inside of us. So now coming to emotion regulation. Emotion regulation is a term generally used to describe a person's ability to effectively manage and respond to an emotional experience. It's in line with what we're discussing already. Identify internal states and then manage emotions to effectively manage our emotions, respond to these emotional experience appropriately, regulate So regulating our emotions means managing our emotional responses in a way that is helpful and appropriate to the situation, rather than being completely controlled by them. Emotions we need not let it control us, but it's in our hands. Again, by identifying our thoughts, our emotions, control smooth enough and allow regulate emotion regulation allow lash out outbursts for the little things, for the slight triggers, they would cry and they're not able to regulate themselves. But as we grow older, adolescence, adulthood, this ability to regulate ourselves increases. And there are, this ability is more and some less, even if they are mature adults. So even for those who are struggling with this, there is hope. They can still learn to regulate themselves better. And all this violence, substance abuse, I think it arises from difficulty in regulating emotions. Relationship issues when we talk about regulating emotions, it does not mean that we suppress our emotions, but we take the emotions into account and we listen to it. We develop an appropriate response and how to respond to this appropriately. for example, anger, an unregulated emotion, a person with unregulated emotion may yell, insult someone, break things, lash out on any impulsive behavior. But a regulated person may recognize the anger, take time to cool down and express concerns assertively. Pause. And then anxiety, an unregulated person may avoid every situation that feels uncomfortable. But a regulated person, emotional response would be acknowledging the anxiety and still taking necessary actions. So, emotion regulation involves several skills. Practically, to apply support to these are the steps. First is awareness. Understanding. Noticing what you're feeling, awareness and need. For example, I feel disappointed. Understanding that, identifying why you're feeling it. I feel disappointed because I worked hard and did not get the outcome I hoped for. Third, acceptance. Acceptance, it's okay that I'm disappointed right now. It takes a level of acceptance also to our emotional states to regulate ourselves. Sometimes we can't do anything about it, about intense emotion, so we just accept it. We just allow it to feel certain things. And fourth, managing your response. For example, I'm upset, but I'll respond thoughtfully instead of sending an angry message. Pausing and choosing appropriate response. Not letting our auto reaction or autopilot mode to take control of us. Because emotions, there are negative and positive emotions, but they are not, there is no bad or good emotions. All emotions indicate something about us, about, again, our needs not being met. For example, I just want to emphasize that we are in control of ourselves. We need not succumb to our automatic thoughts and automatic reactions. And again, emotions that ignores it does not disappear. We need to handle it. We need to deal with it. We need to feel certain emotions and develop an appropriate response. So for the mental health, what are the protective factors for good mental health, to promote better mental health? So one is social support, friends and family. It's not about the quantity of it, but it's the quality of your relationship, your social support. Whether you're feeling heard, whether you have the space to express yourself, whether you're feeling loved and understood, these matters. And if we find that our social support is lacking, we can do something about it. We are adults and we have our adult resources to go and get get our needs met. And physical activity. Physical activity also promotes better mental health. I'm sure a lot of you experience that. Because there's an interconnectedness of physical and mental health. If our physical health is good, our mental health is also good. But if our physical health is poor, then mental health it follows suit. It fuels each other. So physical activities or other protective factors of good mental health, and adequate sleep. Sleep quality affects our mood and our energy levels. I'm sure you must have experienced irritable, so like groggy, feel some tiny mood meaningful hobbies and activities. It promotes better mental health. When we talk about psychological matter, I always like to compare the psychological interventions, approaches to medical practice, medical model. Rakat anio lum me khatsuna na ni Christian me khatsuna rohong khao wang ani dong problems pang ani dong that bao da way kumeki we sometimes we may find that it still doesn't answer to our our struggles. It's not this thing a relief to our struggles. And we still look out for doctors for our physical health need, healing treatment so kalum de ki ho medical treatment influence wisdom develop so progress so and we use that although we pray about it also. Just like that, even psychological approaches, I believe that it's instrumental. We can use it as a tool to understand ourselves better and to deal with our problems or our issues in our lives. Because again, it's God has given the people who have developed these things, these psychological interventions, approaches, the knowledge and wisdom to come up with this, and we can definitely use it to for our better to better our mental health. Hay ta di he as I prepare some ho very doi la kan he kuma questions na mai ram te share sulani mai
I have come to a point of life where confusion has been knocking my door quite often. To cut short, pressures have been pouring in from different angles. My friends and relatives have been trying to convince me to settle down, whereas my bank account has been in ICU since the opening day. So when I keep hearing the same suggestion again and again, it kind of gives me mental stress.
Yeah.
So I'm not bragging about myself, but I've been handling my emotion on my own. Being a psychologist, according to you, what would be the best way to regulate my emotion? Should I just ignore them and stay focused on my own world?
Okay. I think a lot of people here are feeling attacked right now. Feeling guilty of commenting all those. Yeah. In line with what we just discussed, it's very good that that you're handling it very well. You're keeping calm, but frustrates wong ram gan ta ma sam tiam gan ta li pam tong ni nai ni kata you can express it. You don't have to kadok lao na kham ram ki you can be assertive in a nice manner. Lai pong di hai ta sa ai ko hai ko ma ha po comment ta khare tum cha kita ni in a nice manner, assertive but polite. So I'm sure others will also respect that you don't have to avoid and put up with it. So yeah, you can draw boundaries, you can assert yourself.
khang kan thalam close of kami ko mo women are more expressive ni more emotional experience mutual from na tu pang expressive su thoi ni sun ni ko mang gon ba na conscious mai ni mi ro nam khang phok mai hey kum eta khang ta kanai ka ko long karna expressive su thoi mi nói thế ko ma expressive style mang mi nói he ni he long ko expressive su thoi tin nga accuse lo to ni som ho nang emotionally intelligent su ma ke tana accuse lo bi to hay ti ha su ni lo so tum ta thoi ni
thank you cảm ơn đình thế có mà số mình gan cả ta how do you feel
attack
you feel attacked you feel attacked you don't agree to that
yes
you feel that you are expressive in your own way
no not expressive but I think I can regulate my emotions just for myself ni without expressing express mai tong feeling ti express su thoi ma ke mi khang regulate su han na ni he kum ma mi ti emotionally intelligent su ma ke tana accuse su to ni he ti chu ni lo so
I mean how am I doing I think you are sang ma man he nang kum sik so to me ho ki if you feel that that's wrong you can step up and then or that comment might be a good feedback for you also to ask yourself, am I really like this? And instead of feeling attacked, instant reaction to attack, that's a good feedback for you to ask yourself. So maybe there's scope, and you can talk it out. How am I? You can ask more. How am I? What makes you say that? You know, example for Milana. Otherwise, if you feel attacked, you close up and you shut down, and relationships are in person. So instead of that, have an open discussion, ask more what they mean, then maybe you'll get some examples. Whether you agree to it or not, that you can decide later. But yeah, I think it's important to stay open to such feedback.
đi thăm nhé gan tua là mong chính tùng background nó sao nhé vì mình cái movie ra tan nên là nhỉ mà first World War, second World War, Gulf War kuma thì do ra tan này cũng hoàn qua PTSD nè post traumatic stress disorder từng so what almost every movieเขาก็มาเรียกกันนี่นะvậy nên khoảng cái này hay có ta and then movie khác và hàng nhiều từ hay American Sniper như ta PTSD tung movie khác có mình na hay cái nhiều cũng mà đi ta tung bao bạn tung angle ni PTSD vùng này thì cũng mà war is cái này mà violence người bằng tận mà PTSD tung case pami tung zo cũng Hawaii na cũng mà khác là coming back to our context nhiềuแต่Manipurนี่แต่ว่าเรา war zone นี่ฮะแบบนั้นก็ and then Manipur นะฮะแต่นี่ตรงตาวนู่นนะสิแต่ว่านิวปั๊มนี่นะสิถ้านิวแต่นะสิแต่ voluntary อะไรข้างหน้ามาวงเขาเนี่ยนี่ตรงวงมันคือว่าวิตามมาตัวฮะนี่ที่ตัดแต่ตัดบางนิดหน่อยนะนี่นี่วงthat the PTSD cases wong that men ni songam that ni wong ni no he he kan ko sam man ko kan ta nai ni Instagram ka chat la kan ram mental health issues lam ko mo na and then practitioners bangai me ra mi tum kan ni he ta sa kai to ho de mental health practitioners bangare na ni ko bang ko te PTSD ni don cases pangom na ko ram mi pang ko tum wong là phải handle làm như how như preparedness ra nhưng mà cái ta question khác nhưng mà ram ko su ko bon yes ko mi rewe to to ho cũng hơn là anh younger generation panga for example nang tung career kuma anh hiểu tuni career ta khang encourage suai to ho tui tung for example te oina si confuse suai te BA psychology na ye MSc psychology na ye clinical psychology ta hay bi ta so bi ta so te tani in ka summary la na as a career ni tung wo mo ngai me campus tang khni we as a career so ni tung nai to ho as a career nang ta kai ni to ho detail thana to tio ni means ka mana te wa ti ka highlights la wan ni da tung lam ka ni so kai so ku ma hai ti ku ma ko san chai ma ni
The first question, are we equipped in the near?
Are we prepared or ni tung preparedness ko so ni
Oh.
Gồm bên đại thì mình thấy đi question cả gồm mình tung chances kẹo cùng low sự cho and then asala một suy này project tung ta tiện cả some supplements nào nhé last year ta ni tung tao khana si suicide cases pedai này nhé khá là outsiders na đấy thì có thuộc họ ni tung tao local mình na one họ ni tung very close friend đấy cũng tung Jaga so kana 25 to 30,000 to population no ko this is very alarming on ma khat ne kum jang to na he gum tena ko ne he no han ning he not necessarily PTSD but kum he ni tung town ko ke ni tung rasa berkaitan ni tentang ni ki tesom kuma medicine tung psychology nang so khat to ne he tung tani new ko hoi na kriu ti thawai ran bini ni itu tadi dah,
yeah. Man saya tu cuma tahu conflict zone kerana PTSD tu ni apa kait ni so, tahu PTSD tu ni something traumatic happened to them, so they have flashbacks and they're not able to go about their day and say go back to their job or even with their family members relationship ni tu impact so kait tu main so hai ta noi mangan noi ni nu de we're susceptible to it, we're vulnerable as individuals, as humans living in a conflict zone ni but ani tu yes nang sokam kuma mental health practitioners, mental health professionals that caters to these concerns. But our new church really plays a role in Kalomikal Bible teachings. I think not to discount that it has an impact, it's helpful. But sometimes, again, like I said, just like we depend on medicine for diseases or for physical ailments, we need to depend on psychological strategies so to have an understanding. I thought the need is definitely there, and our course in our own individual lives. I mean, the information is out there. It's in our reach. We can look up on it, how to help, how to be aware, how to help ourselves, how to help others. In our own way, and we can also do a little research. Equip mental health professionals that can cater we can also do something in our own individual capacity. Yeah, so then headline how to put
as a career.
As a career. Confusing this is had a clinical psychology to it or resume or BA in psychology law, a master's in psychology law that MPhil further specialization and psychology bankas so school child psychology sports psychology ni the clinical to me disorders pang the deals so I don't specialize in hospital posted to 2 years training alongside bisa PG students bang ni doctor zambang bang. So psychiatric department bang kau training suwe, kuma therapy ni su, assessment ni su, kuma interventions, psychological interventions su hai. There was MPhil in clinical psychology ye ki hai ya not the typical MPhil research oriented MPhil ramangtina. It's the name is quite misleading actually. It should be a professional training course for clinical psychology to have. Because it's going through changes put on field. They are trying to do away with MPhil altogether and masters karina direct ni. So nimi tong tiya kanal UGC tong revision course ta. There was grad BA rina 4 years so like masters rina 2 years hello para to tiya clinical psychology tani milang ta kuma masters in clinical psychology to tiya kanya you'll be certified.
Clinical MSc ni MA ni.
I thought there was MA subang to. The MSc kang so da kang subang to.
Okay.
So yeah.
Thank you.
Again, asking for a training. Social media comparison di bagay na must have I mean youngsters kuma anxiety di bagay nila unnecessary. Like say if I post my all the social media account today, will that reverse? I mean, there was some theory from the example, like case study or something like if we remove the stressors, does that stress vanish away? Because what I know that these things like picture or something, once registered especially get picture or whatever. Inside mo and it's not the situation. In the sense that like everywhere exam like say in psychology to be so and how can we tackle this one?
Okay. The first question
social media
will it go away, the stress go away? It depends if your stress is because of that. If you know for a fact that that's causing you a lot of stress, mental unrest symptom, definitely if you remove the stimuli, the stressors, you feel much more calmer and relaxed. My influencers so detox, social media detox, they experience that effect, the positive effect of it. And then you pointed out something very important around how the substance use it's rampant. Orange Festival I think allow pang even as young as 14, 15, I was very shocked to find out that 14, 15 years habits. I think it has to do with a lot of several factors. One is peer influence cultures and habits and forms and really substance abuse people, parents who have used the substance, they are much more the child whose parents have used substance, they are much more likely to use as well. So observe na models bang dim ho, it's easy for them to get into it. Kom tong ni noi hai ni rakhad kuma pam roi mi pang nga kuma boy na sin na ti ho peer influence unhealthy so de kuma baw lang tong na. And secondly, I think there's lack of engagement for youth, for young people. Especially men, boys have a lot of energy. It's important for men to chase after goals. Tu mi pang hang so sing gon pang hai drive idea na to dopamine hit lo hang ni. And where do we get our dopamine? Dopamine is a chemical in the brain that releases feel good chemicals. When we playing games, you're chasing, it's a competitive thing. Dopamine hit pang so football kan sports ka kan competitive na hiam ma sin la ngon me pang putong drive la na to conquer and to achieve things. Kom iso pang hai drive noi ba me kata opportunities rao to dim ho say kupsana activities besides church, besides studies. There isn't much boredom currently feeling empty and purpose lack of purpose. You're bored, you don't have purpose, so you're easily bored, and when you're bored you want some stimulation, and substances are a good stimulation. It gives you like quick hit, instant hit team that feels so satisfying temporarily, but people fall into that habit because in that loop, because substance is so addictive in nature, and repeated use na loop louds sin ni ton sin na bao lo poi mak mi tong kan bong in ani
Take on something new as like beautiful.
Oh yeah. I don't have all the answers, but in my opinion, I think it's important. I mean, having youth fellowship like this is so important also. The youth activities na my BYF tong activities pang. It's one way to get our social needs met, need for connection, and having a goal that you're striving towards. This is also one good platform. But besides this, I think there can be more things. Society develops. There can be other secular things also, secular activities also, to work towards development, financial development, economic development, social development. Scope na society ka ton. So I think creating platforms like that would help.
Din ka kan ka loneliness and emptiness ke kha ki ka ka ni khan gen ko ta ma mai ni aro no problem of ni ho era ne ta me ko problem bang ni ho hai so na loneliness in ran ko we need social connection na sai ni ki te on sai ko social connection ni mo na ko ba me ding ko ni we feel loneliness ni ko me to reason ko me to ni mai ko na we sai ko na ko mai ning na mo na thut na na ram ni we feel empty ni ko me to we don't sit na ta so we tin na so to me ta na khang thoi ka thoi ko thoi dai kim khang thoi ko la ka thoi tao mo me ta ni ta na ni share la mai ta point sai ta share la wo ko ta awareness, that understanding, acceptance, have a follow up, and have a also for them.
And we know it's a common phrase when we say we can still, loneliness is not about whether we're alone, but it's about how we feel whether it's with people or without people. We can be on our own and not feel lonely at all also and we can be in a room full of people but we still feel lonely. I think that's because again close it's about quality over quantity. How you social connection to me, and not being around people, any random people, but people whom you feel being around people where you feel accepted, where you feel heard, where you feel understood, and deep down who you are as a person, acknowledge me. I think it's so important. So when we feel like that, we can question what is it that I need in this moment. I mean, what is it that I need from people, or what need is not being met. It could be it could be any of the things. Not feeling heard, not feeling understood. Socialize shallow jokes it feels so draining sometimes, and when we're not talking about what matters to us. So it's so important to identify individuals in our lives, friends, families, who gets us, who understands us, where we feel safe, where we are expressing our authentic self, and identifying these people and then going to them when we feel drained, when we want to feel rejuvenated. I hope that answers.
I don't know if you have mentioned this. Thoughts influence feelings, and feelings influence behavior. I assume a lot of vice versa with I assume behavior influence feelings, and feelings influence thoughts to me. But I can't assume correct
Behavior influence feelings. I think it could be a ripple effect. Because of a certain thought you felt certain things, and because of your behavior, it might influence further, to repeat the pattern. But I believe the root cause has to be thoughts, feelings, behavior. I think that's how it usually is. And sometimes feelings can influence thoughts also, but the triggering point, I think, stems from thoughts.